Hi, my name is Stephen Samis. I'm Vice President Programs at the Canadian Foundation for Healthcare Improvement. And today I'm just here to reflect on really 5 or 6 things that I've been most proud of in my time here at the Foundation, work that we've done together, and where I am excited about where the Foundation will be going over the next few years. I'm going to be leaving the Foundation very shortly and moving on to a new role. And so it's been a really interesting opportunity to kind of sit back and reflect on 7 years here at the Foundation and the work that I've been able to do with an amazing team of people and what we've done together. And so I'd like to share some of those reflections with you. I guess the first thing I would have to say is I'm really proud of the role I played, and I'm proud of what the organization has done in terms of creating a new mission and a new set of goals and a whole new strategic direction for the Foundation. Back in 2011, we did an extensive consultation with healthcare stakeholders. We looked for an opportunity for the Foundation to fill a niche, to fill a gap, and people told us that there was a real need in Canada for a national healthcare improvement organization, an organization that would bring people together across the country to try to really focus on healthcare innovation and new ways of working for the benefit of all Canadians. And we listened to that, we heard it, and we began to develop programming that really started to take traction. You know, I think the second thing I would reflect on as part of that is that I am just so proud of having been part of is the amazing team that I've had an opportunity to work with here at the Foundation over 7 years. Incredibly passionate, committed, intelligent, wonderful people who are really come to work every day trying to make things better for Canadians, really passionate about the mission of the organization. I think the third thing that I'm really proud of and that I would say has really marked my experience of here is the Foundation's commitment to really demonstrating value to our partners in helping them and supporting them to do things differently and better, and our commitment to measurement, to measuring the extent to which we're improving the patient and family experience of care, the extent to which we're driving better outcomes and better care processes, and trying to get better value for money and the incredible amount of money we spend in healthcare in this country. So that commitment to value and the values that go along with that, that the organization has developed for itself. The commitment to patient and family-centered care. This idea that we can really truly change healthcare for the better, bringing patients right into the decision-making processes and helping them to help us to redesign systems based on what patients need. That's been a tremendous learning for me, is the insights and the value that comes from having patients and family members at the table with you as you're thinking through things and implementing and measuring results. It's qualitatively different than when they're not at the table, and we're all richer for the process. So I think that would really be the fourth thing that I'm really proud that this organization has been a champion of now for many years, and I certainly have learned a tremendous amount by the patient and family members that I've worked with in my time here at the Foundation. What has always been a great day for me at work is those days when we're bringing organizations together from across the country. They're all committed to doing something differently and better in healthcare. They're there from across the country, across jurisdictions, across different provinces and territories, whether it's in long-term care or the acute care sector or primary care or wherever they're coming from. They're there to make a difference. They're there to improve the care experience for patients and family members. Their passion for what they do, when they're sitting in a room and the noise in the room in the workshop is palpable as they're engaging and learning from each other and celebrating their successes, that's an amazing day for me at work. And we have had so many of those days where we're bringing leaders together across the country and we're feeding off of their passion and their commitment to doing things differently and better in healthcare across the country. That's been one of those things that just makes me spring up out of bed every morning and say, I want to work in this place. I want to make a difference. We are making a difference and we will make a difference. I'm really excited about staying in touch with CFHI, working with it from a different role and a different perspective, and watching the Foundation grow and flourish over the next few years.